Hey guys, Dr. St. Jean here at the chiropractor.com. This is the fourth video in the Reduce Your Inflammation, Reduce Your Pain video series. Today we're going to talk about how you can use sleep as an anti-inflammatory method to help reduce pain. Keep watching. So here's the deal. You're probably watching because you're in pain, right? So if you're not sleeping long enough, if the duration of your sleep is not significant enough, or if you're not sleeping well throughout the night, you're tossing and turning, you're waking up, then you really want to pay attention here because the connection between sleep and inflammation and therefore pain is quite significant. Beyond affecting your ability to actually reduce inflammation and therefore pain with sleep, missing sleep can take years off your life. Studies have shown that women that work the night shifts have an increase in 400% risk of developing cancer. That's significant. Also, other studies have shown that any sleep that's less than 7 hours triples your risk of developing sickness. So the importance of sleep extends well beyond inflammation. It is crucial to your overall health. So the next logical question should probably be, how can you improve the quality of your sleep and the duration of your sleep? Actually, it's quite easy, just shifting some simple rituals that you might, or behaviors that you might be doing each night before bed. Let's get started on those and talk about those so you can start implementing them and starting to reduce inflammation and pain immediately. The first easy way to shift and improve your sleep is to make sure you have the right temperature going on in your room at nighttime. So you really don't want it to be so hot to the point where you're sweating, and you don't want it to be so cold to the point where you're shivering. You have to find that happy medium. That's pretty difficult for married couples, especially my wife and I, because she likes it really, really warm. And I like it really, really cold. And neither of us in the end are right. You really want the range. Science suggests that you want the range between 60 and 73 degrees Fahrenheit. That's the suggested range. And the closer you are to 60, the colder you go, the more it will induce sleepiness. So remember, this range is going to help improve your sleep quality. Another great way to improve your sleep is by creating a sleepy environment and setting the ambiance. You definitely don't want to simulate Walmart lighting. That would not be good. That lighting is super intense. Put yourself for a second in Walmart and remember that would not be a sleepy environment. You want to set the mood for your sleep neurotransmitters. You want to get them going, get them excited so that you can actually induce sleepiness. Artificial light is a big problem. For myself, we live right on the main street, right in Chicago. There's a ton of artificial light pouring into our windows. What do? We got blackout curtains. Blackout curtains are going to prevent that artificial light from coming in, hitting my eyelids, and stimulating wakefulness. We don't want that. That will disrupt sleep. Check out blackout curtains. Those are really potent. Another thing is setting the mood in terms of sounds and smells. So we'll use essential oil diffusers. We'll put some lavender in there. We'll put some frankincense in there, anything that calms the mind and cools us down. And then for sounds, we like ocean sounds. We like to feel like we're sleeping next to the ocean, sometimes rain, sometimes crickets, whatever gets your mojo going. But you want to kind of manipulate these variables so that you're really inducing this very pleasant, relaxing state and almost like a sanctuary that you're walking into. Really, really effective, really easy to do for sleep. Another important factor to consider in terms of sleep quality is going to be late night snacks. Now there's a lot of debate on this topic, but there's 2 points I want to make here. The first one is definitely avoid consuming simple carbohydrate late night snacks. That's just going to wreak havoc on your blood sugar. What goes up must come down. The same applies to blood sugar. You'll have this sweet little treat before you go to bed. A couple hours later, you'll wake up because your blood sugar is crashing. That's a stress, cortisol is released, and boom, you wake up. So if you're going to have a late night snack, or if you find yourself waking up in the middle of the night and you're not eating, it could be because your blood sugar is just dropping naturally, not maybe because you're eating something that's sugary or high in carbohydrate before. In that case, you might want to try having a more protein and fat-based snack before you go to bed to help regulate your blood sugar throughout the evening and prevent wakefulness. You had to know this recommendation was coming: technology. There's no easy way around it. Basically, all electronics, iPhones, computers should be out of the bedroom, right? Get them out. And in addition to that, stop looking at those screens. Whether that's a computer screen, an iPhone, a TV, stop looking at those before you go to bed. I know there's some of you watching that say, hey, you know what? I can only fall asleep when I watch TV. That may be the case. Right now, that might be a pattern you've developed. But I will tell you that your sleep quality will improve when you stop doing that. So get that stuff out of the bedroom. Stop looking at the screens at least an hour before you go to bed. It helps not just improve the sleep quality, but it helps wind down the mind, right? We are always on. These things are like lifelines to us, and it's nice to escape and focus a little bit more inward or with your loved ones and just calm down. So get these things out of the bedroom, really important. In addition to setting up a sleep schedule like we just talked about, exercising and getting some kind of access to sunlight during the day is going to be also great for your circadian rhythm. If you're out there exercising, let's say you're running or even just doing some calisthenics in the park, whatever it is, when you're accessing that sunlight and stimulating your body with exercise, you're really hardwiring that biological clock to know that, hey, it's daytime right now, so then when the lights go down, your body says, okay, it's time for rest, it's time to sleep, it's time to recover. Of course, there's several other recommendations in terms of how you can improve your sleep, simple things you can do in the comfort of your own home, but let's start with the ones that I just gave you. Remember, build a foundation before you build the house, right? Start with those simple yet effective recommendations I just gave you. See if they improve your sleep, see if they improve the quality and the duration, and if not, no, don't get worried. There's other things you can try, and if those things don't work, there's also specific functional medicine testing that we can do that we can determine the underlying causes of your sleep issues. If you want to work with myself, click the link below to schedule a consult with me now. We can learn about how we can improve your sleep and therefore reduce your inflammation and reduce your pain. Otherwise, keep watching. There's more great videos coming. This is Dr. St. Jean. I'll see you next time. Bye-bye.